Nice to meet you. My name's Jolene. I'm from Lear Initiatives, and I'll be helping you guys out today. How,
Okay,
mhm,
okay, all right. In front of you is the patient and her mother. They did say they're happy to meet you and they're happy to answer your questions. Her daughter's name is Amina and she's 2.
you know, awesome. All right. So first, I like to start off with, I just like to ask, the mother's name,
Yes, thank you. Yes, thank you. Hey, Hajara. Her mom's name is Hajara.
Majera. All right. Nice to meet
Yeah,
everybody. So I would like to say that the baby is female. Is that correct?
yeah, yeah, she's female.
Okay. And what about your family life? I'd like to know who do you live with, your living environment? I'd like to be able to understand that a little bit.
Okay, sina samba ilang kids zama? Yalwa. Okay, ain't now. Okay, they check it. Okay. All right. She stays in Bauchi State, which is a northeastern state in Nigeria. And she currently stays with her husband. She's her only kid.
Only kid. Okay. And
Yeah.
what seems to be the problem today with the child?
Oh, she did say that Amina's been having fever, she's been having diarrhea and some abdominal pain for about 1 week now.
2 weeks now. All right. And for the fever, does the fever seem to be ongoing, consistent, or is it like coming and going?
Sabi niya kan zo ita, siya magani dan lapa. All right. She did say it comes and goes. It's more at night.
More at night. And how long has the fever been there?
But it's been here for 1 week.
1 week. All right.
Yeah.
And has the baby experienced any headaches? Does she seem to be complaining about her head?
Oh no, she hasn't been complaining of headaches.
No headaches. All right.
Yeah.
And as for the stomach pain, um, has she said that it was extremely bad, or is it just a little bit of discomfort?
But she did say, well, it's mild to moderate, not really,
Wow.
severe. Yeah.
Okay. And as for her skin, does she see any red rashes?
Well, she's got no rashes, but they should say that she's got some mosquito bites around her body.
I see. And so do you sleep with mosquito nets at night?
A gida kuna samun kwanciya cikin gidan sauro? Kullum kuke kwanciya a ciki? Okay. She does sleep on that treated mosquito net.
All right. And in their home or like around the home, does there seem to be stagnant water?
Yeah, yeah. It's quite swampy and she's got stagnant water around.
Okay, so it's pretty common. All right. And does she seem to be showing any coughing?
Yeah, she did say she's coughing and she does produce some sputum and she says it's brown colored.
A brown color. And is there any chest pain?
And she's got no chest pain.
No chest pain. Um, how
Yes.
how about sneezing?
Tana ng atishaw, Bob. She's got no she doesn't sneeze.
No sneeze. Okay.
Mm.
And is there any nausea or dizziness?
Akwai tana nuna kaman ba ƙarfi a jikinta ne kaman kasala haka. Okay, okay. Occasionally she does, complain of dizziness.
All right. And as for diet, what is usually that what do you usually consume and eat?
So she consumes foods that predominantly starch.
Predominantly starch.
For
Okay, all right.
Barangama, I can. Sorry, I got distracted. What did you just
Okay.
say?
Uh, sorry, you did say that she usually consumes starch.
Yeah, yeah, predominantly starch, but occasionally she does also get some proteins.
Occasionally. All right. And has she ever said anything about wanting to eat um things such as like sand or ice that are usually non-nutritious?
Okay, no, no, she hasn't been, having any of such behaviors. No.
No cravings, nothing like that.
Yeah, she's got none of those cravings.
All right. And as for the environment she lives in, is it a um, dusty kind of like a lot of smoke coming from a cooking?
Okay, yeah, at home they do use firewood
Use
to
firewood,
cook. Yeah, and she does get some smoke around.
and the cooking occurs inside the house.
Yeah, it does occur inside the house.
Inside the house. Awesome. Also, how about your source of drinking water? Is it clean or do you not have access to it
Okay, they do get some water from, community water supply from the government.
from the government? And would it be clean or it's
Yeah,
just
yeah, it is clean.
it is clean? Awesome. Okay, so I would like to run some tests. Specifically, I'd like to take a chest x-ray as well as a, complete blood count, do a rapid diagnosis test, and a blood culture.
Yeah, I'm glad you've asked for all these tests because yeah, we did everything and starting with the chest X-ray, we did see some abnormality in the lower lung zone. And as for the rapid diagnostic test, it was also positive for malaria. For the complete blood counts, hemoglobin levels were within normal. It was around 12 gram per deciliter. And we actually did a throat swab. We grew some bacteria,
From the
and
throat.
yeah, yeah,
Okay.
yeah. We did grow some bacteria as well. So yeah, those are the things we could do for her.
How about, did you conduct a blood culture?
Okay, yeah, we did a blood culture. It yielded some bacteria.
Okay, and just to confirm, the hemoglobin level was 12?
Yeah, it was 12.
Okay. So, from the chest X-ray, because there seems to be some abnormalities in the lungs, unfortunately, she does have lower ARI. To treat this, I would prescribe some antibiotics to fight off the infection. As for the rapid diagnosis test, because it is positive for malaria, we would need to prescribe ACT and antimalarials to be able to fight off the parasites. As for the bacteria found in the blood culture, it's necessary to prescribe some antibiotics for that as well. As for the fever, if the fever continues and it worsens or anything like that, it would be necessary to give some antipyretics. And in general, please take some rest, lots of rest, and drink lots of fluid. Are
All
there
right. So
any Mhm.
sasabihin gwajin da aka mata, an mata wasu gwaje-gwaje ko? Ok, ya nuna dai akwai zazzabin cizon sauro, sai kuma akwai alamun mura da sauransu. So, za a ba da magani. In ya so, ta fara shan magani? Ba rubuta magani ba tukunna. Za a rubuta mata magani. Yau, in ta fara sha din, in Allah ya yarda sauki dai samu. Amma dai nan gaba dai ana so san samu dai. Tun da kin ce dai tana kwana cikin gidan sauro. Sai kuma amfani da maganin sauro da sauransu. Wanke hannun za ta ci abinci. Yawa duk in kin san yara ko ma mene in ya siga yawa shi garkuwar jikin nasu bai karfi sosai yanzu ba to yawa wayan abubuwan zai kare su nan gaba. Kin gane? Kina da wani tambaya ne? Tambaya batun abubuwan da muka faɗa. Oh, okay, okay. All right, she says thank you, and she's got no questions. She fully comprehends what you've told her, and she appreciates you for your show of concern.
Thank you so much. And also, I would like to advise that if possible, when cooking, try to avoid using firewood and possibly try to convert to using coal to minimize the amount of smoke that everybody is exposed to. As for in general, continue to ensure that the drinking water is clean. And when encountering mosquitoes, make sure, if possible, to kill them off and also get rid of the stagnant water if possible near the homes.
Okay, sai kuma inda dai dafa abinci da sauransu zai zamanto da yanda hayaki ba a son duk abin da zai kawo mata hayaki yadda za ta ringa shaka don shi din ma zai ringa haɗa mata wannan tari din. Yawa sai kuma inda na gaya miki ɗazu kwana cikin gidan sauro sai kuma in ta fita ma kamar da dare ko kuma da yamma haka ya zamanto ta sa kaya sa hijabin ta yanda hannayenta da ƙafafuwanta dai sauro ba za su samu hanyar cizon ta ba. Sai kuma yanayin ruwan da za ta sha ma ya zamanto mai kyau ne. Okay, she says thank you.
All right, thank you so much. I wish you all the best.
I ce ta gode Allah ƙara sauki. Okay, okay, all right. I'll say yeah, yeah. You did a very good job, and yeah. Let me just ask you, how do you feel after your performance?
I believe I was definitely a little bit nervous and my thoughts were a little jumbled, but I think being able to ask the questions and because you were able to provide the all the necessary information, I believe that I did perform decently.
Yeah, I really do believe that you did an amazing job. And yeah, you did provide your diagnosis after comprehensively, asking the questions to help you reach that diagnosis. Your treatment was also very good. And I love the fact that you did, spell out all the preventive measures, which is, very important in managing our patients. So additionally, I love your communication skills. You are empathetic and yeah, you've got all the good qualities, and I'll say yeah, congratulations, and I'm impressed with your performance generally.
Thank you very much. I appreciate your help as well.
All right, so thank you for your diagnosis. Do have a nice day.
You too as well. Thank you so much.
All right, bye.
But goodbye.